Good morning. Good morning. Happy Wednesday. Happy Wellness Wednesday. I hope you are all feeling like wellness warriors today. It is February 18th, I think. Yes, it's the February 18th, and I'm running a little bit later than I like to because I actually kind of got caught up in my Facebook memories, and I discovered that the video I was actually going to refer to here, that this is kind of a little bit of an expansion on, was actually about a year ago. It was supposed to be on the 19th last year, and it ended up getting postponed because of something that was going on health-wise with a loved one. And it never ceases to amaze me, rather, how cyclical life can be and how some of these things pop back up. So I will drop that video in the comments when I'm done today because it's pertinent to what we're going to talk about today. I knew I had done something similar topic wise, but I didn't realize it had been literally almost exactly a year ago today. Actually, next week will be a year ago because it got postponed, but it was originally intended for this time last year. Okay, so if you are just stumbling on my page, my name is Donna. I'm a mom, a nana, a girlfriend. I am a jazzerciser, a runner, a line dancer, and I am a wellness advocate, and I like to think of myself as a wellness warrior. I started Wellness Wednesday because I have been in a lifelong journey with anxiety and depression, and I have learned that when we share tips and tricks with each other, when we share information with each other, some things work for some people, some things work for other people. But when we share, that helps us to learn new things and try new things and move forward in our healing journey one way or the other. So if you're just stumbling on my page, welcome. And I hope that you will engage, that you will ask questions, that you will interact. I always keep this politics free. We have enough negativity in our worlds. But if you're here, let me know you're here. And if I don't see, if you don't see this till afterwards, hit hashtag replay in the comments. And if I don't, Facebook likes to hide things. So if I don't respond to you or acknowledge you, it doesn't mean I'm ignoring you. It means that I didn't see you. Facebook didn't show me you were here. So if you have been with me for a while, you know that last week we talked about the new food guidelines. There was a lot of information there. Whenever we talk about diet, because it is an important component of wellness, and when I say diet, I mean what we choose to eat. I don't mean a specific diet. Whenever we talk about that, there's always a lot of information and it always runs a little long. So last week's video was a little long, but it's going to be here on Facebook for 30 days. And it's also on my YouTube channel now. So you can go back to it as you need to check it out. And I will drop all of those links in the comments to last week's video, to my YouTube channel, all of that. But today we're going to shift back to our brains because wellness frequently boils down to mindset and how our brains work and how, more importantly, how we respond to how our brains work. So today we're going to talk about some unwanted intruders and what they are and why they happen. And that is intrusive thinking, intrusive thoughts. There's a lot of misunderstandings about intrusive thoughts, and I used to be one of the people that misunderstood those. And when I look at my Facebook memories and when I realized that that I literally talked about this topic to a point, not under the umbrella of intrusive thinking, but under the umbrella of not everything you think about is true, or not everything you think is true. And that was literally almost a year ago. It brought back to mind what was going on in my world at the time, why that episode got postponed, the health things that were going on with somebody close to me, and how much the intrusive thoughts came barreling in around that time. So we're going to talk about that. What are intrusive thoughts and why do they happen? Because those thoughts, they happen to everybody. Bad thoughts happen to good people. It is human nature. So let's talk about it. What are intrusive thoughts and why do they happen? Well, the definition the general definition of intrusive thoughts is that they are unwanted, involuntary, and distressing thoughts or images or urges that enter our minds. They're often focused on socially or morally unacceptable thoughts, violence, inappropriate things, religious or moral issues. Sometimes they're related to contamination, and they can very, very often, at least in my case, be related to fear of something happening to a loved one, fear of worst case scenarios. And I, when I look back over my lifetime, especially as a mom, as a girlfriend, as a grandma, I have a lot of intrusive thoughts, not as much as I used to, and I handle them better now, that are very, very vivid. My very vivid imagination kicks in. And so when I have these intrusive thoughts, it becomes a whole visual in my brain that is sometimes really scary. The Anxiety and Depression Association of America calls these stuck thoughts. And again, we've touched on this before in a much lighter way when I did the video, Don't Believe Everything You Think, which was about a year ago, ironically. So intrusive thoughts are very common. It is estimated, I'm going to stress that number, that 90% of the people experience them, but that they only require treatment when they start causing significant distress or interfere with daily life. And a key point here with intrusive thoughts, and it's going to be important a little bit later here, is that we generally know they are wrong. We know they are strange. We know they are incorrect. And most of us reject them quickly by ignoring them or redirecting thoughts, etc. Now, the first thing that comes to mind when I think about intrusive thoughts, especially some of mine, is I'm going to show my age here with shows like Ally McBeal and Scrubs. By the way, Scrubs revival next week on Wednesday. So excited, can't wait. Scrubs is actually one of my favorite shows. I never really watched Ally McBeal, but I remember seeing commercials of scenes where Ally McBeal kind of, whatever was going on in her head became a visual. And sometimes it was like of somebody, maybe her, good morning, Miss Kayla, maybe Ally, picturing herself as some kind of monster or dinosaur that bites the head off of the person she's talking to. And in Scrubs, my favorite character and the character I identify with, JD, often checks out mentally, and his intrusive thoughts, if you will, or his daydreaming turns into this very vivid visual in his head. But most of the time, in most of these cases on TV, these visuals were to bring humor. And a lot of times the intrusive thoughts that we experience, they're just not funny. Sometimes they are. Sometimes my intrusive thoughts are funny. And if you're in the area and you hear me laughing out loud to myself, mind your business, because it happens. But my experiences have been, I've had some scary intrusive thoughts, especially, and if you may be able to identify with me here, if you're a parent, not long after my daughter was born, I would be outside hanging laundry. We had this old gas furnace that didn't work, in the mobile home that we lived in. And I would be outside hanging laundry. My daughter would be inside sleeping, and I would get these visuals of the trailer exploding. I had so much fear surrounding, some of mine are too, Kayla. So, maybe we can make our own TV show to kind of follow up on Scrubs and Ally McBeal. But a lot of times my intrusive thoughts were very, very tied to being afraid that something terrible, something catastrophic was going to happen to my daughter. And that is not unusual. A lot of times we have these irrational fears and thoughts that attach themselves. And I say irrational, that's relative, that tie themselves to thinking that something is going to happen, or being afraid that something is going to happen to someone we love very much. In my case, there was a skin disorder that cropped up in the family, and I became very paranoid about that and had a lot of intrusive thoughts about that. And my daughter went through head lice as a child a few times over. So there was, I got to the point where, if I even saw her look like she was reaching to touch her hair, I wanted to examine her head, and I became so paranoid about that particular issue that it really became kind of problematic for a while. It didn't interfere with my life, but it did kind of get to the point where my daughter was like, "Don't touch me, Mom," because I couldn't keep my hands off of her head. So these intrusive thoughts are things. Most recently for me, I saw a video the other day, and that's kind of what brought this topic back up to the surface. And this is where I'm going to talk about my faith a little bit, because it's made a huge difference when it comes to intrusive thoughts now as an adult. I have them. I still have them. I don't have them nearly as often as I used to. But I saw a video the other day, for those of you that are watching that that believe in God. I saw a video the other day that talks about how bold Satan can be, and that he'll pull right up to the table when you're sitting down talking to God, meaning during prayer or whatever, if you can kind of get this visual in your head, and he will try to dig right in, right there. No matter how much you were trying to redirect, he will pull right up to the table and start digging in with those intrusive thoughts. And I've definitely experienced that. There's ways now that I handle that as an adult and as a woman of faith that are different than the ways I used to. But we can, if you want to know more about that, you can shoot me a message. In any case, specific causes about intrusive thoughts are not completely understood, but they are most often linked to stress, trauma, hormonal changes like postpartum depression, and menopause, mental health conditions. A lot of times, when somebody thinks intrusive thoughts, the first place they go is OCD, which is an obsessive compulsive disorder. But mental health conditions like anxiety, which lines right up with everything I've ever experienced, and depression and PTSD. And then, as I said, most often OCD. And with OCD, these intrusive thoughts are generally accompanied by compulsive urges, not just the thoughts themselves. So it's important to understand that there's not a specific cause that's understood behind it. And again, I'm not a mental health counselor yet. I am studying to be one. But this is general information from Harvard Health, from NAMI.org, and a few different places that all kind of lines up and mashes up. Now, again, intrusive thoughts don't mean you're a bad person. And sometimes people associate intrusive thoughts with disorders like schizophrenia. And those are not intrusive thoughts. That's a little bit of a different animal. Because most people that experience intrusive thoughts, even if they actually have full-blown OCD, they know that those thoughts are not right, that they're not okay, and we don't typically act on those thoughts. Although sometimes those with OCD, those intrusive thoughts are accompanied by compulsive urges, like the need to do certain things out of the belief that something bad is going to happen. So that's essentially what intrusive thoughts boil down to, and kind of why they happen. So how do we identify them? Well, they're unusual. That's for starters. And they're different from your typical thoughts. Although if you're like me, I've been having them for so long that they don't always seem different. Are they different from my day-to-day thoughts? Absolutely, because they're laced with fear and a little bit of paranoia, and not the positive outlook that I generally have. But so being different from your usual thoughts is subjective, depending on if you have anxiety, if you have OCD, and if these are something that you experience on a regular basis. More importantly, they're disturbing and they're repetitive, and they can sometimes, or very often, feel hard to push out of your mind or feel like you can control them in any way. They just kind of keep creeping in, and you'll be like, that's ridiculous. And then it starts coming back in again. Typically when we're, like I just said in reference to schizophrenia, typically intrusive, or even OCD, intrusive thoughts do not typically result in acting out the thought. They might look like a visual where you're kind of visualizing acting out the thought, but you're not actually doing it. You're not actually going to do it. Whereas impulsive thoughts come with urges to behave in certain ways that lead to spontaneous actions, and those are seldom in a positive way. And that's where we start getting deeper into those mental health disorders. So that's essentially it. I don't know of any other ways, and I was not able to find any other ways in my research that were clear indicators of other ways to identify them. We just know that they're negative. We know that they cause us stress. They cause us anxiety. They may cause us to ruminate if they're associated with depression. And most of the time we ignore them, or we go through whatever they've triggered, our PTSD, our anxiety, our depression, our rumination. But then we're able to kind of go about our day and just keep those in the backs of our minds. Whereas, as I said, in certain disorders, they can lead to spontaneous actions, not all of which are positive. So how do we manage them? Well, first of all, and this is really important, we do not assume that they mean something horrible about us, or that we want to commit those acts. And that is a myth. And I have an article from the Anxiety and Depression Association of America that talks about that myth. And the fact that we often believe that these thoughts mean, and we're going back to Freud here, that these thoughts mean that we unconsciously want to do these things that come to mind, or want to see these things happen, or whatever it is that's, good morning, Miss Heather, whatever it is that's intruding in there. There's a myth that's associated that says this is an underlying urge to see this happen, or to perform this act, or whatever the case may be. And that is not true. And when I talked about this a year ago, when I talked about how not everything you think is the truth, and your brain being a liar, we were talking mostly in terms of the things that we think about ourselves. And so that still applies here. But when we're talking about intrusive thoughts, this sometimes kind of blows up and gets a little more serious, and these thoughts get a little stranger and a little scarier. So no matter what it is, whether it's smaller intrusive thoughts that are telling you you're not good enough, whatever that case may be, or whether it's bigger ones that tell you that something bad is going to happen to somebody you love, they do not mean there's something horrible about you. They do not mean that you want to commit those acts. If you're, imagining literally biting somebody's head off. I can remember a very few times in my life where I got so angry that I can remember visualizing doing something physical to the person I was angry at, shoving a glass in their face, picking up a table and shoving it in their face, to the point where I was gripping on the side of the table to keep myself from doing it, but then I didn't do it. And the faith side of me recognizes times where I probably was like a little far gone, because I don't remember how I went from visualizing that to putting the glass down by my side instead of having it pulled back like that. So again, these horrible thoughts don't mean that necessarily that you want to commit those acts. That is a myth. Or they don't mean that you're a horrible person. That means that you are having intrusive thoughts, and that sometimes it's related to you reacting to something that's made you angry or made you fearful. Good morning, Miss Dawn. So that's the first step in learning how to manage them, is to recognize that they don't mean you're a bad person. Just because you thought it doesn't mean it was true. And that's what we talked about a year ago. Mindfulness and acceptance are one of the ways they talk about managing it. And a lot of people don't understand mindfulness, and I still have a little bit of trouble explaining it. But mindfulness is where it started for me in terms of getting a lot of my anxiety under control, to the point where my thoughts weren't as scary to me. So what that means is when you have these thoughts, it's acknowledging the thought, that it's just a thought and that doesn't mean anything. It means that you don't necessarily have to judge that thought, that you can redirect or refocus. In my case, a lot of times I would start having these anxious thoughts, these intrusive thoughts, and I would it would distract me from what I was doing. And then I'd be pacing around the house and I'd be, why am I thinking this? And going through all the, dissecting it to a gnat's behind in my head as to why I was doing this and judging myself. And what does this mean? We don't have to do that. We can just be like, okay, that's a thought. Now, what was I working on? It's hard. I'm not going to lie. It takes a lot of practice. But knowing that we have that ability to say, okay, I see you, but you're not interfering with what I'm doing right now is huge. It's huge because once you go ahead and you go through those feelings, but you focus on whatever you were working on, or I do, and the edge starts to come off. And then I can look at that thought later if it's even still there, you know, and it'll come back. It'll be like, hey, Donna. And I'll be like, no, no, no. And you can give it a name. We talked about that in one of my videos, was naming that thought in your head. So mindfulness and acceptance, accepting that the thought is there, but just because it's there doesn't mean it has to be true. Doesn't mean you have to figure it out. Doesn't mean you have to label it. And that's huge. And, that's one of the things. There's a blog here that I pulled and I have a graphic that I'm going to drop for you. It's 7 steps to respond to intrusive thoughts. It's really good. And she talks about this too. The mindfulness angle, which is to notice and label and remind yourself that it's just a thought. And that, like it or not, our thoughts are not always within our control. We can choose not to give them life or choose to give them life. Accept the thought, observe it mindfully. She talks about all this, and I will drop it in the comments when I'm done. And the name of the blog is Authentic Emily. Just so I can make sure I give proper credit. So stress management is also part of this. Yoga, meditation, breathing exercises. And yes, I'm going to say it because I always say it. Lifestyle choices. One of the biggest things for me, besides learning not to judge myself or pick every thought apart, was starting to exercise every day or most days and cleaning up my diet. Those things all had critical influence on my levels of anxiety. And when my levels of anxiety are down and they're controlled, guess what else doesn't happen anywhere near as much? And that's those intrusive thoughts. So that's really, I can't stress it enough. Am I saying you have to go run a half marathon tomorrow? No, absolutely not. I am saying that when we move our bodies on a regular basis and move oxygen and move blood and kick up those endorphins, which can be done in a lot of different ways, that it makes a huge difference, and that there are certain things in our diets. I'm drinking a little bit of coffee right now. Let me just tell you that I know my limits. When I rarely have more than 1 cup. When I have more than 2 cups, I can feel my anxiety just going off the rails. And then all of a sudden I have intrusive thoughts and I start questioning whether I'm good enough for anything or anyone and all those things. Soon as that anxiety stokes up, all those intrusive thoughts come rolling back in like, hey, she opened the door, let's party. So stress management is really important. Yoga, meditation, breathing, diet, and exercise are critical. I'm doing research for a paper right now that consistently shows that cleaner diets with less processed foods, less inflammatory foods, more antioxidants contribute to better, to positive improvements in mental health symptoms. It's proven over and over and over again. And we're just now starting to talk about that more. So another thing that can really help is to maintain a routine that keeps your focus. My days are very busy. I'm time blocked. I leave room for flexibility, but what I don't give myself room for is spending time in that cycle when those intrusive thoughts start. And I just had it happen the other day. I got some weird random thought in my head, and I started to kind of follow it down its little trail. And all of a sudden I was like, no, now is not the time. I need to focus on this. And I couldn't even tell you now what that thought was. Okay. So again, it takes a lot of practice. It is doable. It takes a lot of practice. I'm not going to lie. Again, just like most of the other things we talk about, Rome was not built in a day, and we don't get this way overnight, and we can't necessarily fix it overnight. It takes a lot of practice and it takes work. Most importantly, it takes recognizing when we're doing it, because that's the first step for us to be able to go, oh, there it is. Okay, I need to stop that. How can I address this? So stress management, yoga, meditation, breathing, lifestyle, we talked about that. Maintaining a routine that keeps your focus and your attention away from inside your head. Seeking support of family and friends. This is really important. If you have people close to you that know that you have intrusive thoughts, then when you start speaking those, they'll be like, hey, what's going on? You know what I mean? They'll know enough when you confide in them to be like, hey, are you feeling okay? What's going on? Because that doesn't sound like you. And then, of course, you can always seek a mental health professional. CBT, which is cognitive behavioral therapy, for those that don't know, is one of the most often recommended treatments for intrusive thinking because it focuses on reframing thoughts that aren't true or that are erroneous, distorted. There's lots of different words for it, but perceptions, the way we think about things, reframing that, which is basically what I'm talking about here when I'm talking about labeling it, not judging it, not picking it apart, just, oh, there you are, you're intrusive, you stay over there. Reframing our thoughts can have a direct impact on our emotions and subsequently our behavior. So that is most often recommended. And sometimes if the intrusive thoughts are really bad and really hard to get a hold of, then medication is recommended, especially if there's underlying conditions causing it, like PTSD, anxiety, OCD, things like that. But the same things, as I said at the beginning of this episode, the same things don't work for everybody. So it is going to be trial and error, and you have to be a little patient with yourself to learn what is going to work with you. A lifestyle change in diet and exercise can solve the problem for a lot of people. For a lot of people, it's only going to reduce it a little bit. They're going to need more help. For me, I am medication free currently. I am not as anti-medication as I used to be because I understand that some people need it. Right now, my anxiety is very well controlled by lifestyle and by the things that I'm continuously learning. But I also understand that with the right order of events, that might change. And I can live with that. So remember that the same things don't always work for the same people, but there's lots of different things to try that wouldn't necessarily replace therapy and wouldn't necessarily replace medication, but could significantly supplement it, help it out, whatever. All right, so when do we seek help? Now that we've talked about treatment and medication, when do we seek help? Well, basically, if we are uncomfortable with the intrusive thoughts we're having, and we feel like we're being significantly affected, even if it's not necessarily interfering with our daily function, we can seek help. You see, there's a misnomer that you have to have a mental health condition to seek counseling. That's not true. Unfortunately, insurance kind of ties our hands on that, and if we want our insurance to pay for it, a lot of times we have to have a diagnosis. That is just the way insurance works in the medical world and also in the mental health world, which there shouldn't be I shouldn't have to specify a separation, but there is still a separation. So, unfortunately, insurance reinforces this myth that you have to have a mental health condition to seek a therapist. It's not true. Now, if you don't want a diagnosis and you don't want it covered by your insurance, there are places that you can go where you can pay cash. There are some places that do it on a sliding scale. There are also life coaches, wellness experts, counselors, therapists, you name it. If you're going to choose a life coach or a wellness expert, and I did look into doing that, to be perfectly honest with you, but certifications are all over the place. I don't mean they're not good. I just mean that for me, if I'm going to talk to people one-on-one about how to get better at anything, about anything, I want the rigorous credentials behind me. There's a lot of great certifications out there for life coaching, for wellness coaching, etc. But for me, I wanted those more rigorous professional credentials behind me. So you can seek a life coach. Just do your research. Make sure you're getting somebody that has a lot of references, that is well known, has a great reputation if you're using a life coach or a wellness expert that requires a certification versus a license, or find yourself a counselor or therapist. Again, I cannot repeat enough. You do not have to have a mental health condition to seek help. It's a myth. And if you're local here to the area and you want a few places, you want some more information, I do know of a couple places that work on sliding scales or accept cash payments, blah, blah, blah. You can also find support groups. If you're experiencing anxiety, like NAMI has support groups for adults living with mental health conditions, and they don't require a diagnosis. So if you feel strongly that you have anxiety or you have PTSD, whether you've been diagnosed or not, you can go to these support groups. You can find a connections recovery support group through most NAMIs. Sometimes there are separate anxiety depression groups through other organizations, so on and so forth, etc. So when do we seek help? When we feel like we need it, period. We don't have to have a mental health condition or be needing a diagnosis to seek that counseling. And we definitely seek help if these intrusive thoughts are disrupting our daily life, if they're impairing our ability to function, our ability to work, our ability to maintain relationships, because intrusive thoughts can come in the form of thinking that your partner is doing something wrong, even when there's zero evidence that they are. And those bring a lot of intrusive thoughts. I should check their phone. I should follow them. I should, whatever. That's a whole rabbit trail that could be gone down. But if these thoughts are disrupting your daily life, you're impairing your ability to function, work, maintain relationships, or enjoy the things you love, then it is time to seek help for your intrusive thoughts. So I don't want to keep long, I try not to run these too long. There's a lot of information here. I want you to remember these things. And again, for those that have intrusive thoughts that are more related to how they think about themselves, I'm going to drop last year's video in the comments where I dealt with that. But I want you to remember these things as I wrap up. Just because you think it doesn't mean it's true. I used to wholeheartedly believe, because I would sometimes think things and then they would happen. And that makes it really easy to assume that whatever's going through your head is true. That's not the case. So just because you think it doesn't mean it's true. I was about to launch into some more examples, but we're out of time. Intrusive thoughts do not equal bad person, broken person, and they also do not always indicate a mental health condition. Again, estimated 90% of humans, adults, have intrusive thoughts at some point in their life. Okay, so doesn't equal bad, doesn't equal broken, and does not always indicate a mental health condition. And then remember that intrusive thoughts, again, and I said this earlier, and I said it, I would mention it again later, are not the same as psychosis or losing touch with reality. They're not the same. In those cases, people don't understand that those intrusive thoughts are that. They think that they are real. They think that they are the truth. And so that's a whole rabbit hole for another day. But again, it's not the same as psychosis. If you're having intrusive thoughts, it doesn't mean, I can't repeat this enough, that you're bad, that you're broken, or that you have a mental health condition. And then finally, I'm going to say it again. It is okay to ask for help, whether you think you have a mental health condition or not. It is okay to seek help with a counselor, a wellness coach, whatever, wherever it is that you live in your comfort level. It is okay to seek help as long as you make sure with any of these that their credentials are intact, whatever those credentials are, and that they have references and some kind of a reputation. So it's okay to ask for help, period. And you are not alone on this. I hope you found this helpful. Again, I've got this 7 steps to respond to intrusive thoughts. I'm going to drop in the comments along with the video for last year, which was basically your brain is a liar. Don't believe everything you think. I think one more link that I'm going to drop in the comments, along with the link to my YouTube channel. If you want to be able to go back to this at your leisure, add it to your favorites, playlist, subscribe, whatever, so that you can go back, because Facebook only holds these live videos for 30 days. After that, you can find them on my YouTube channel. All right. Thank you so much. I hope you found this helpful. If you found it helpful, please share. Feel free to shoot me a message if you have specific questions about something I said here, or if you have a topic idea that you want me to consider. And until next week, have a fabulous week and be well. Bye.